All right, let's talk about something that I know gives a lot of you some serious stress: mental health medications on the NCLEX. It feels like this giant mountain you have to climb, right? Just endless lists to memorize, but what if there's a better way, a smarter way to tackle it?
And this is exactly why we need to get it right. Because look, the stakes couldn't be higher. We're not just talking about points on an exam here. This is about real-world patient safety. Getting this stuff down isn't just about passing the NCLEX, it's about being a safe nurse.
See, the thing is, the NCLEX has changed. It's way beyond simple memorization now. They're not going to just ask you to list side effects. Nope, they're going to test your judgment. They want to know, can you give these meds safely? Can you spot trouble when it's brewing? And, this is the big one, can you figure out what to do first when everything hits the fan?
And that's the million-dollar question, isn't it? How do you go from staring at these long, scary lists of meds to actually feeling confident? To knowing you can handle whatever kind of question the NCLEX throws your way? How do you make that leap?
Well, that's exactly what we're going to break down right now. We're going to look at a framework, a system that helps you turn all that anxiety into confident action. Let's get into it.
Okay, so before we get to the solution, let's be real about the problem. We all know psych meds are tough. But why are they so hard for the NCLEX? If we can nail down the why, we can figure out the how to beat it.
I bet some of this is going to sound familiar. You know, trying to remember the tiny differences between an SSRI and a TCA, or what you have to watch for with MAOIs. And then you see a sign of toxicity. What do you do first? When you're sitting there, clock ticking, making that one right call, that's everything.
Okay, so here's how we start to fix this. We're not about just dumping more lists on you. We build frameworks. Think of it like a mental map. Let's start with a big one, antidepressants. We're going to chop this up into pieces you can actually handle.
And check this out. This is where the magic happens. Instead of trying to memorize 20 different side effects for every drug, we focus on the one big, scary thing that NCLEX really cares about for each class, the life-threatening stuff. So for SSRIs, you think serotonin syndrome. For MAOIs, you immediately think hypertensive crisis. See how that simplifies things?
All right, let's try it out. Mini scenario. Your patient is on an MAOI. They just ate some aged cheese, and now they have a severe headache and feel nauseous. Ding, ding, ding. What's going on? And more importantly, what's your very first nursing action? Think about it.
And that right there is the whole game. Recognizing the problem, hypertensive crisis, that's good. But knowing the priority action, that's where you score the points. That's the kind of next-level thinking we focus on.
All right, let's keep this framework rolling. We use the exact same strategy for the other drug classes. Next up, mood stabilizers and anxiolytics.
And again, we're not boiling the ocean here. We're zeroing in on the biggest risks. You see lithium, you think two things: therapeutic range and toxicity. You see a benzo, you think safety, sedation, and dependency. Simple, right? High yield. Okay, another one for you. Your patient's on lithium. They tell you they have fine hand tremors and they're peeing a lot. So, is that just a normal side effect we can brush off, or is it a huge red flag? Your judgment call here is everything. What lab are you going to check? Stat.
And this is such a classic NCLEX move. They love to put you in that gray area where you have to decide, is this expected or is this dangerous? Being able to tell the difference, that's what makes you a safe, competent nurse. Okay, you're getting the hang of this. Let's do one more. We're going to apply this exact same framework to antipsychotics. And you guessed it, knowing the difference between the typicals and atypicals is a huge deal.
So when you think typical antipsychotics, like haloperidol, your brain should scream EPS, extrapyramidal symptoms. But when you switch to the atypicals, you've got two big monsters to watch out for: the deadly neuroleptic malignant syndrome, or NMS, and major metabolic changes. These are not just trivia questions. These are huge patient safety issues.
So, final scenario. Patients on haloperidol. Suddenly, they get super rigid muscles, a spiking fever, and they're not making any sense. Whoa, red alert, right? This is a full-blown emergency. What is the absolute first thing you are going to do?
Spotting that this is NMS is step one, but it's not enough. The points and the patient's life depend on you prioritizing the right intervention. This is where your clinical judgment literally saves lives and gets you that passing score. So, are you seeing the pattern here? We're not just throwing random facts at you. It's all part of a system. A core principle for how to think on the job, how to think like a safe nurse.
And here it is. This is the simple three-step process that ties everything together. Step 1, safe administration. Step 2, critical monitoring. And step 3, priority action. That's it. You use this simple framework for every single medication scenario.
So this isn't just another content review. You've already read the textbooks. This is a system. It's a mental model that helps you make those tough calls, under pressure, without missing a beat.
And here's a little secret about the NCLEX. At the end of the day, every question is really asking the same thing. Are you going to be a safe nurse? That's it. So the safest, most timely action, that's almost always your highest scoring answer.
Look, we don't just teach you about mental health meds. We train you in NCLEX-level judgment. We help you build the skills to think and act like a pro, especially when it really matters.
And what you've seen here, this is just a tiny preview of our approach, the complete, in-depth framework for absolutely nailing mental health meds. Well, that's waiting for you inside.